Thanks, Tim. Can you hear me okay? We're good.
Loud and clear.
Great, thanks. So I've been involved in the Wotton area mutual aid group, and this is a group that was set up locally by some residents who work at the charity hub in Wotton, and they've got experience of dealing with people in need, and they had a chat and discussed the idea that we should just do something locally to support those who are particularly vulnerable. So a few of us met up at the weekend, and then we ran a public meeting on Zoom the following Monday, and there were over 100 people who attended that meeting. So there was just a real groundswell of support to do something and to support vulnerable people in the local community, which was brilliant. So in terms of how the group got organised, that did take a little while to work out the best way to set up a system so that those people who are offering support can most easily be connected with those seeking help. And we used the model of a Bristol-based mutual aid group, so people would submit their request using an online form or via a phone number. We've managed to get a dedicated phone that was kindly donated by someone. They put their request in, and that request is automatically uploaded to a spreadsheet, and then people who volunteered to be a helper or to volunteer their own support, they check the spreadsheet and they can respond to people who need the help. On the basis of experience over the last few weeks, there's now a separate form that you can fill out for prescription collection, because we're finding there was a real issue at the pharmacy where people were only allowed one person in the pharmacy at a time. There were 2 metre spacing between people in the queue. And so the queue for the pharmacy was right down the road, and the number of people who brought along chairs to sit on while they were waiting, because if they weren't in the best of health, they perhaps couldn't wait 20 minutes or perhaps even longer to collect their prescriptions. So the pharmacy request form is working really well, and there's just one person who collects all the requests per day now, which is really good. I've got a fantastic team of volunteer admins, so they're monitoring the requests that are coming in, monitoring the phone, making sure all those requests are logged, taking any queries that come in either through the Facebook page, the email account that we have, and making sure that requests are removed once they've been completed. So we've got people on shift from 9 AM till 6 PM 7 days a week, and each of the admins does a 3-hour shift, so it's a reasonable amount of time, and there's one person who's always a point of contact for the day in case they've got any queries about information perhaps, or references, or how we're linking with other organisations. There's some issues around, I guess, data privacy when you're thinking about a lot of people sharing information about their vulnerabilities and their contact details as well. So we've set up a very simple system in Wotton. So when somebody would register to be a volunteer online, they have to agree to some really simple data protection rules, which is that they can't share the data they're given with anyone else, they can't leave that information available, and they have to delete it once they've used it. And we've said that all volunteers have to be over 18. We've had quite a lot of enthusiastic students who haven't got any more studies to do wanting to sign up, who are a bit under 18. And there are different ways that they can help, but it does help to keep it manageable, to keep this to adults only. I've had an amazing response. There have been over 400 volunteers last time I checked who've signed up, which is quite incredible. There has been a little bit of feedback from volunteers that there are never any outstanding tasks to do because they get snapped up quite quickly from the spreadsheet, which is where the requests are going. And there's an awful lot of mutual aid that's just happening between friends and neighbours and people on the same street, and family members as well who are local. But despite that, there are still a lot of requests coming through the spreadsheet. People are monitoring it really quickly and responding, which is brilliant, so the system's working. And in the anticipation that we will have increased numbers of people who are self-isolating and needing help in our local community, I think it's great that we do have the resources in place now to help that to happen. It's been brilliant to have a good link as well with the 2 GP surgeries in the local area, and that's helped us to be aware of any particular issues that they have, and maybe share information with our volunteers as well. So do volunteer newsletters on email as well as putting information up on Facebook. And to get out the word, we've done a lot of posters, leaflets. Some people had concerns as well about whether we should be leafleting. during this current period of lockdown. So we've been following the safe leafleting guidance, which involves wearing gloves, making sure that you've got small numbers of leaflets that are kept together in a separate bag. We also have the fantastic Postimates, which have been brought out of a retirement as the election campaign is over, and they can be used as well. And then making sure that people are just doing small amounts of leafleting at a time, and that they wouldn't be leafleting if they were feeling unwell as well. So I think we've had to balance the risk there of people going out against people not getting the information. And while there's loads of information for people who are online, for those people who aren't, there is a risk that they could perhaps not be aware of the support that's available in their local community. So just a few things that the group's been doing recently. They very helpfully sent out the 4th newsletter this morning, so I can give you an update on some of the things they've been doing. One issue has been around money, and how you can get money from people if you're collecting urgent shopping requests. I've got an arrangement now with the manager of the local co-op store, and so if a volunteer from a mutual aid group is doing somebody else's shopping, they can actually take the co-op's portable contactless card machine out to the neighbour that they're doing the shopping for, and that can all happen on a pay-by-card basis, either with a PIN number or with contactless. And they've produced a fantastic little video which explains how you do that as a volunteer and how you make sure it's safe all the way through by wearing gloves and respecting distances. I was trying to highlight other initiatives that are happening in the local area. So one chap came forward who's a local chef, and he wanted to make free soup for everybody. And the mutual aid group wasn't able to do this, but put him in touch with a local church who has large kitchen facilities. So last week there were 90 portions of soup that were being delivered to people who either needed it or quite fancied some extra soup to cheer themselves up over lunchtime. And there's going to be more free soup going out this week, so that's been brilliant. Seven Vale Kitchen, you might have heard of them as well. They're offering healthy, tasty, affordable meals in the Seven Vale area on a not-for-profit basis. So they're offering 7 meals for £25, and they can produce upwards of 1,500 meals per day. They've got subsidies for those who can't afford their meals. So again, we're looking to kind of promote and support those people who are setting up their own initiatives to get food out to people. Martin mentioned the grants that are available for community groups, and with support from the officers at the District Council, the Wotton Area Mutual Aid Group has been awarded a grant, and we're going to be using this money in a number of different ways. So raising awareness of the group, costs for posters, flyers, information that we're going to put out around the local area. We're going to buy a couple of contactless card machines. So for those people who do pay for prescriptions, we can make sure that that can happen without the volunteers being out of pocket. We're going to have a fund to reimburse volunteer expenses. So if people are doing a lot of driving, there'll be an opportunity to reimburse that. And some PPE, so gloves that could be needed for deliveries, and hand gel as well. So we're looking to make sure that we can account for all that money and working with the local town council for that to happen. There's been real interest from the villages as well around Wotton. So the local parish councils in North Nibley, Hillesley, Charfield, and some others, Wickwar, as far as Wickwar in South Gloucestershire, are also really interested in being part of this mutual aid process. We've had inquiries from right the way out to Tortworth and Fellfields too, so there's a real interest to engage with a local system that's putting people in touch with each other. So that's been really positive as well for sharing right across the local area. And we are just on the county border in Wotton, so we're publicising the information which is about the Gloucestershire community response and also the South Gloucestershire response. And they similarly, they've got the same structure. They've got a community hub where requests will go and then be sort of triaged by the district council and then shared onto local mutual aid groups like the one we have in Wotton. So there's plenty going on. We're aware of the mental health impacts that people might be experiencing as well, through self-isolation, through health worries, and a whole range of other things that are happening. And we've identified one member of the group who's got a lot of experience with safeguarding. and have thought about what would happen if somebody's offered to give a phone call to somebody who's self-isolating because they're lonely and is concerned about their mental well-being or their health. And there is a referral process, so if a volunteer comes into contact with somebody who thinks they're not well, then we do have somebody who can refer that on to a GP confidentially, just so that volunteers feel they can share that information. And there's loads of tips out there for volunteering safely. The latest was from the Gloucestershire Constabulary. They did some guidance for community volunteers on social distancing, protective measures, taking payments and using PayPal. There's some national government guidance on the gov.uk website, which is about how to help safely, and that's got some good tips as well. It's quite sensible, but it can be reassuring for people to see that they are following the guidance, which is great. And we're just looking to try and spread the word, really, encouraging volunteers to talk to their local neighbours, local friends and residents, so that if anyone does find themselves in a situation where they can't get out of the house, they know there's a way to get their shopping, which is great. Trying to support local businesses, of course, where we can. I've produced an interactive map which shows which businesses are open, whether they can do delivery, and there's a new list that's just been published today. And encouraging also the local businesses on the high street and the surrounding area to put a request for delivery onto the spreadsheet if they would like to have their food delivered to a customer. And then the local volunteers are also helping to support businesses by taking food, and mostly food and groceries, really out to the customer. So again, that's one more way we can try and help to keep the high street alive. So the feedback so far has been great. I mean, obviously people might feed back to the volunteer who's dropping off the shopping, but there has been some comments that have been made centrally to the admin group. So there was one person who managed to get a prescription, had a sick child at home, couldn't leave the house, was very worried about health issues, and just said it was a total lifeline having the prescription delivered, which saves them having to go out of the house. And then we also had a contact recently from somebody whose elderly mum lives in the local area, and that person lived in Australia, and she was aware that her mum was lonely, not able to leave the house, so she got in touch via the Facebook page, and again we've been able to sort that out so that we can make sure that that person is receiving somebody to drop off shopping. And as we are living in quite a dispersed way, it's nice to be able to connect with the local mutual aid group for your volunteers. And I think that's about it, actually, Tim. That's a bit of a run through of everything that's going on. Thank you.
That's fantastic, Catherine. Thank you so much